So we have we have these updated vaccines, both this year's influenza vaccine and the newest updated COVID vaccine in the province. It started to arrive in September and October, and we continue to encourage everybody in British Columbia who's eligible to get those vaccines and to get them at the same time. And as you know, we started the process with people in priority populations, so seniors particularly, seniors and elders over the age of 65, residents of long-term care homes, which have all been have had opportunities to be vaccinated across the province, Indigenous peoples, pregnant people, healthcare workers, of course, and people with those underlying illnesses that make them at higher risk of having more severe illness, both with influenza and also with COVID. Most people by now have received their invitations through our Get Vaccinated system, and I know lots of people have been taking advantage of the availability of vaccines across the province. To date, we've administered over 1 million doses of influenza vaccine, and I think the total today was 1,070,000, a little over that, and over 847,000 doses of the COVID vaccines. So I want to give a little bit of an update on what we're seeing in terms of the key viruses that cause illness this time of year. And all of these data are put up weekly now on the BC CDC's respiratory illness page on the dashboard there. So all of the pieces that are in there give us a good sense of what's happening across the province with all of the viruses that we're concerned about. So one of the big things is we had a fairly early peak of COVID, and it has leveled off now and started to come down. So we're seeing both things like the test positivity, people who are sick with COVID, so cases, hospital admissions have decreased in this past 2 weeks from a peak in early October. And critical care admissions, so people who need ICU care and deaths from COVID remain relatively stable. And again, we know that the people who are most at risk are older people. So our hospitalizations are primarily in people who are over age 60. And particularly, most of the severe illness is in older people over the age of 80. Though I have to say, unvaccinated people at any age remain at greatest risk and highest risk of having more severe illness, ending up in hospital, and we know as well the potential of having long COVID after infection. And I just want to touch on a recent paper. There was some media about this in the last couple of weeks that really shows us how effective vaccines have been. So this was the seroprevalence study that looked at how many people have evidence of antibodies from vaccination and or from infection across the province by age group. And what we've seen is that older people were well protected by vaccines, which is great. It also means how important it is for us to keep the updated vaccines to make sure that we give a boost to that protection. And for most people in the province, we have this combination of vaccination and infection that gives us a high level of population immunity around the province. And for most of us, that meant that we were vaccinated. The infections that we had were very mild, and many people didn't even realize they had that. So that's that hybrid immunity that we have. So this emphasizes to us the importance of getting these updated vaccines that not only give a boost to that protection against hospitalization and more severe illness, but also protection against the strains that we're seeing circulating right now. And from what we're seeing, and that's again on the BC CDC website, you can see that, we're still seeing Omicron variations that are causing most illness right now, slight variations of the XBB particularly. So we're seeing a new one called HV.1, but also XBB 1.16, 1.9, and EG5, which have been around for the last few months. The other viruses that we're looking at, of course, are influenza and RSV. And so RSV test positivity has started to increase in children. So we're seeing that primarily reflected in data from labs at BC Children's Hospital and other labs around the province. And what we're seeing now is that we're seeing levels that are kind of a little bit above what we would expect at this time of year from pre-pandemic levels. But not what we saw last year where we saw a dramatic increase early on in the season. So overall, RSV activity across all ages still remains low, but it's starting to increase now. Influenza as well, we're starting to see that increase, and it's a bit more normal, from more in line with what we used to see in the pre-pandemic days. It's mostly influenza A and the H1N1 strain of influenza A. About 80% of the influenza detections are that. We've seen very little influenza B right now. And interestingly, there's one of the strains of influenza B called Yamagata that we haven't seen worldwide in the last 2 years. So that's an interesting phenomenon that we're watching as well. And while we won't have vaccine effectiveness data yet until a little bit later in the season, what we are seeing is those strains that we're able to detect of influenza show a really good correlation with the ones, the clades we call them, that are in the vaccine. So far it's looking like a good match, which is another reason why it's important to take that opportunity now to get the vaccine as we're starting to enter into more of the respiratory illnesses, particularly influenza. The other thing that we can see on the BC CDC dashboard is we monitor visits to community healthcare practitioners, so primary care physicians, nurse practitioners, for people who go to seek medical attention for respiratory illnesses. And that's been gradually increasing since mid-August. So this includes all of the things that can cause influenza-like illness, including COVID or SARS-CoV-2, influenza, RSV, but also what we're seeing quite a bit of are still the entero and adenoviruses, and these are what we generally say are common cold viruses. So we're seeing those still, especially in children. And we're also seeing that pediatric emergency department visits are gradually increasing, but are below historic levels. And what we've seen is they're not, last year we saw that rapid increase in both RSV and influenza quite early in the season, and it came a very high peak in November. We're seeing a more normal pattern, or a similar pattern what we'd see before the pandemic right now. So this changes that we're seeing in COVID, or in the SARS-CoV-2 virus activity levels, remind us that there's still a lot we have to learn. And that's one of the things that we're paying attention to as we go through this season. We're still coming out of the pandemic and trying to understand the patterns that we're going to see in the future. But also reminds us again the importance of maintaining our immunity, particularly getting that boost from the updated vaccines. So data shows that, as I mentioned, that COVID is leveling off in our hospitals as well. At last count, there were 244 people in BC in hospital with a positive COVID test, and we know that about 40% of them are there because of COVID, and the majority who have an incidental finding for a variety of reasons. And we were down to 8 people in critical care at last check. One of the other novel things we've been doing since the pandemic started was our wastewater surveillance, and so I encourage people to look at that again. It's one of the things that gives us a picture of what's happening around communities. And what we're seeing is that the SARS-CoV-2 levels that we're detecting in the lower mainland wastewater plants in particular still are increasing, but it's leveled off. And around the province, we have plants in the island health, in interior and the north now. The SARS-CoV-2 loads are either stabilizing or coming down, so that's important to watch. And new this year, we also have been checking the wastewater for RSV and influenza A and influenza B, and those are all up on the website as well. We're starting to see an increase, particularly in influenza A and in RSV, and the lower mainland sites in particular. So that's a harbinger that we may be seeing more illness in the community in the next few weeks. So this is kind of more like what we expected, and it reminds us that this is the time where it's important to get our protection as we're going into the worst part of the season in the next few weeks. November is also no surprise to people, I'm sure. We're seeing more people with respiratory symptoms like cough and sore throat and fever. And one of the things that we're reminding people is that we all know these healthy habits that get us through these types of seasons. These are important messages and ones you'll start to hear more often, not just me saying it all the time, but on radio and TV. Reminds us of the importance of doing those things that we're all used to now. That includes staying home or staying away from others if you have respiratory symptoms, especially a fever. Fever is generally a sign that you have something that may be infectious to others. So fever and a cough, or fever and a rash, or fever and other illnesses that can be transmitted to others, like vomiting and diarrhea. So covering your cough, wearing a mask if you're recovering and around others, or if you're somebody at higher risk, consider wearing a well-fitted or an N95 mask, especially if you're in a crowded indoor space with poor ventilation with groups of people that you don't know. It's always important to continue cleaning your hands regularly with soap and water or using alcohol-based hand rubs. And of course, getting your updated vaccines that give you that best protection. So as I mentioned, most people now will have received their notifications through the Get Vaccinated system, and it's not too late in any way. Now's the time to get them. We know that there's availability across the province, and as I mentioned, over 1 million doses of influenza vaccine and over 847,000 doses so far, and 2/3 of people have been getting them at the same time. So that's something that's available this year that makes it easier for people as well. Most people are able to do this online, but I know there's challenges, and particularly if you want to book yourself as a family. So I encourage you to call the number 833-838-2323 if you have any issues and assistance. And I want to reassure people that we do have an adequate supply of vaccines for everybody to get them over the next few weeks. I did want to mention today a little bit about the high-path avian influenza outbreaks we're starting to see again in BC. We know that at least 16 farms have been affected, mostly in the Fraser Valley, but also some on Vancouver Island. And this is related to the migratory patterns of wildfowl, so ducks and geese, as they do their global migration. And they've just started in the fall migration. So we had a lot of outbreaks in the spring of this year, and this was a phenomenon that we've seen globally, but particularly across North America and in Europe. And we weren't sure whether we would be seeing it come back again in the fall with the fall migration. But we have started just in the past couple of weeks again. And I know this is a major issue for the poultry farmers and a lot of the biosecurity measures that they put in place to try and protect their flocks. The strain we're seeing is one called influenza. It's an avian influenza, so that means it's in birds primarily. It's called H5N1. And so far, globally, there's been very little spillover infecting humans, but it can happen. And it's very concerning this time of the year when we're starting to see human influenza viruses circulate as well. So we really urge people who work on or live on poultry farms, working with birds, to prioritize getting their influenza vaccine. It's an important way of protecting yourself from influenza and making sure that you're not a potential source of infection to the flocks as well. We're working very carefully or very closely with the Canadian Food Inspection Agency, with our animal health partners here in BC, and our public health veterinarians at the BC CDC to ensure that the bird health is monitored in the flocks. We also have seen some wild bird deaths related to influenza, to this avian influenza. Many of the wild poultry, so ducks and geese, don't get very sick with it, but some of them can. So if you do come across a dead bird, you can report it by calling 1-866-431-BIRD, so that's 2473. And they may test it for high-path avian influenza. But I do want to say, only handle it if you need to, wearing gloves, and make sure you wash your hands well afterwards. So just, the risk of infection is low for most of us, given the limited contact we generally have with infected birds. But people like workers on poultry farms, farm families, and others who have close contact with birds are really encourage you and to make sure you're taking the appropriate precautions and to get vaccinated. So in summary, we are seeing a mixed pattern, a pattern that's more like what we used to see prior to COVID being one of the additional diseases we had to deal with at this time of year. Now is the time, if you've not already, to get your updated COVID-19 vaccine and this year's influenza vaccine. And as we head into these winter months, we expect a more usual pattern with more influenza, more RSV, and we'll be watching to see what happens with SARS-CoV-2. Often what we see with influenza is a second peak after Christmas, and often with influenza B, so we'll be watching for that. And it will be interesting to see what happens with the SARS-CoV-2 virus as we go into the winter. So the most important things we can all do are ones that we know: staying up to date on our vaccinations, taking regular precautions like covering your mouth with your sleeve or your elbow when you cough, cleaning your hands regularly, and importantly, checking in with yourself and your children and making sure if you are sick with something that can pass on to others, that you stay away from people, especially people who are most at risk. So postponing that visit to visit an elderly relative if you're not feeling well or if people are sick, if you can do that. These are things that we should all be familiar with now, these healthy habits, and they will get us through these next few months and continue to use to get us safely through and allow us to gather together as we go into the holiday season. So I'm going to leave it with that, and I'll turn it over to Minister Dix. Thank you.
Thank you very much, Dr. Henry. This is the fourth respiratory illness season since the pandemic, the COVID-19 pandemic began. I think we've all now had this experience together, whether we're healthcare workers or involved in the healthcare system or people involved in the community. We know that the actions that we take can make our community more resilient, can provide support and protection for those we care for and those that we don't know. We know that each of us has a role to play in that, and I think it's important to reflect on that. As the weather gets colder, of course, our events go inside. This is the season when people come together most for holiday-related events, and this is therefore a very important time and a very important opportunity, if you have not yet been vaccinated, to get vaccinated and to do all the other steps that Dr. Henry, and no doubt I'll mention again, that we can take to reduce the spread of both COVID-19, influenza, RSV, and respiratory illness in general. And so I want to say a few things about where we stand right now with respect to vaccines. We are leading Canada in terms of vaccination right now. This is because of the take-up and the remarkable efforts of pharmacies and healthcare workers and health authorities around BC, but mostly as people stepping up and getting vaccinated. As Dr. Henry has said, 1,072,000 people have received their flu vaccine in the first month of our campaign. 847,458 have received the updated COVID-19 vaccine. And just to put that in context, because the campaign remains strong, just yesterday, 27,000 people aged 12 and above had their vaccination appointments, 3,400 between 6 months and 11 had their appointments. That's more than 30,000 yesterday. So the campaign continues to be strong across BC. Everyone knows that we started our vaccination campaign much earlier than other jurisdictions in the country, 9 days earlier than the largest other jurisdictions in the country, and we were benefiting from that. Last year we set a record, for example, an all-time record for influenza vaccination in BC at 1,775,000. And so the first month of our campaign to be at 1,072,000 shows that we're in good shape. But there is opportunity across the province to get vaccinated. We regularly add new appointments. So if in your area there seems to be a limited amount of appointments on a given attempt to get vaccinated, there's some communities that have less than 10% availability over the next weeks. Communities such as Oliver and Soyuz, for example, we're going to be working to add appointments in those areas, and we encourage people to keep checking back in their system. More than 1,350 pharmacies are offering influenza vaccination appointments. Over 1,200 pharmacies are offering COVID-19 vaccination appointments. About 1,160, exactly actually, pharmacies are offering both vaccines. The majority of people are getting the vaccines together, and I think that is, of course, a good idea and recommended where able. As Dr. Henry has said, we have ample supply to meet demand. We've ordered 2.8 million to respond to their text message, click on book their appointment, and get both the COVID-19 vaccine and the influenza vaccine. I want to talk a little bit about hospitalization. When we briefed you in advance of respiratory illness season and told you about the planning we were doing, we talked about preparing as we have every single year. We did in 2020 and 21 and 22 and now in 23 in advance of respiratory illness season, because we know that demand for healthcare is increasing, and we know that it has been increasing as well year unto year in our province. We have a dramatic, because of the strength of the BC economy, we have many people coming to British Columbia in large numbers every year, and in addition to that, we have an aging population, increasing demand for healthcare services, and some of the consequences of the pandemic have led to an increase in that demand. Just to give you know exactly what that is. Last year we had very high levels of hospitalization. This year they are higher. So from October 8th, even in a respiratory illness season that, as Dr. Henry said, has been relatively stable, from October 8th to November 7th, we have been caring for 337 more patients per day than we did for the same period last year. That's inpatients in hospital. As of last night, that number was 10,067. To put it in context, it's reached a height of 10,170 over the last week. It does go up and down in the course of a week, so this week it's gone from 9,700 to where we are, about 10,070. So it's 10,072 to be exact. So what that tells you is there's a lot of people in the hospital, and that's why we've taken the steps to respond to that. Our healthcare system is resilient and is responsive to this. Health authorities have confirmed that they are prepared for increased demand due to respiratory illness season. And you'll recall last year, demand went up in our hospitals. The peak of demand was 10,260 on or around January 6th last year. So we are still going to see a rising level of demand for inpatient acute care in our hospitals. But they are grateful, and we are grateful for the determination of British Columbians to get vaccinated in this period. And we have to continue to do that today. As Dr. Henry has said, there are 244 patients in hospital, 8 in critical care, who are positive for COVID-19, and that's lower than last year. But respiratory illness season is just starting, and that's why we've taken action to improve access and flow teams in place for all of our large hospitals, 7 days a week. Focused teams of healthcare leadership, administrators, and physicians have been established on critical care and emergency department to support these priority services now and in the future. Health authorities, our BC Emergency Health Services and the Ministry continue to coordinate our provincial capacity. We are, as one health system, with all health authority partners coming together to ensure people get the care they need. And we have formalized a standard provincial seasonal surge response plan, taking the best of our response to COVID-19 and the learnings from it. In terms of beds, we have worked extensively with health authorities over the summer to review bed counts and the types of beds. In September, I said, as we prepared for this season, that our bed base has been lifted to 9,880. Happy to share that due to additional work, we are actually resetting our net bed base in hospitals at 9,939. In addition to that, we have some 1,500 surge beds available as well for the height of the season over the next number of months. To achieve this, health authorities have identified which beds could be regularized, are clinically equipped, and are use appropriate. The benefit of regularization means staff are no longer in temporary lines, that regular positions are created, that appropriate support services are hired, and that overtime can potentially be reduced, all of which will lead to more patients getting safer care with the right level of wraparound services. We are also adding more hospital at home beds across the province, a very successful program we launched during the COVID-19 pandemic, which will connect patients with safe care in the comfort of their homes. As well, we're working on initiatives to ensure patients who no longer require acute care can receive alternate level of care in settings that include long-term, traditional, or community care. All these measures will relieve some of the pressure on hospitals and help health authorities improve patient flow in our hospitals and ensure there is capacity in our system for our winter surge season. As noted, in addition to the 9,939 base beds, we can add 1,500 surge beds if needed that can be activated through the winter and fall. Progress, and obviously the progress we're making through our Health Human Resources Plan, which we've talked about a number of times before, the 70 actions focused on retraining, redesigning, recruiting, and training, and making adjustments to our healthcare system is having, I think, very positive effects throughout the system. Witness the enormous participation of doctors in our new payment system, which is improving care for patients and communities. This has always been about putting patients first and people first. And we all have a role to play. And I strongly encourage people to follow the consistent advice about washing hands, about coughing into our sleeves, about staying home when we're sick, and surely, and importantly, taking the opportunity to get vaccinated, to follow the path of British Columbia, which is leading our country in vaccinations, and improve that. It will help us in our healthcare system, but mostly it will help you as a person stay well, your family stay well, your loved ones stay well, your grandparents stay well, everyone you know stay well. It's those healthy habits that all of us can follow and all of us have learned during the pandemic that will assist us this season as well. Thank you very much, and I'll ask Dr. Henry to return to the podium, and we'll be happy to take your questions.
Thank you, Minister Dix and Dr. Henry. As a reminder to media on the line, please press *1 to enter the queue. You'll be able to ask one question and one follow-up. I'll start in the room first. Any questions from the room? Go ahead. If you can identify yourself and your outlet, please. Go ahead.
Hi, it's Jim from CTV News. Dr. Henry, I just want to know, how are the care homes, I'm not sure if Mr. Dix can answer this, but how are the care homes doing right now? Are they fully vaccinated? We're hearing news that actually one of the care home in Vancouver has been hit really hard, and there's almost 5 deaths in there. So how are the seniors doing, our parents and our grandparents are doing?
Very good question. And yes, a vaccine has been offered in all care homes across the province. That's one of the priorities that we started with. Not everybody received the vaccines or chose to receive the vaccines, but a vast majority of people did. And we are seeing some outbreaks of influenza as well as COVID outbreaks in a few care homes. I'm not aware of the one you're speaking about and what is causing it, but we do see that all of these viruses can spread quite rapidly in care homes. So it is something that we're working very carefully, closely with our care home colleagues on, and health authorities across the province are paying attention to this. So we do have on the BC CDC dashboard the reports of the outbreaks by the virus once it's detected. in each care home.
Great. Next question, please.
Hi, Kate Walker, City News. The first question, it may be for Minister Dix. You mentioned there's enough supply of vaccines, but some people are mentioning there's issues booking to get their vaccine. One senior shared their story about trying to book a vaccine a couple weeks ago, and it wasn't until well into the new year that they were able to get an appointment. So I'm just curious if there is a kind of a surge in trying to book appointments and having difficulties there.
Yeah, and always with the system early on, there's been some glitches where a lot of people have been trying to book at once, and we have heard on sporadic cases, and I'll let the minister talk to some of the details, but and we did have a delay in some of the vaccine coming in because the Pfizer product wasn't approved for use until a little bit later than expected. So there has been some cases where vaccine, and where pharmacies in particular have run out of vaccine, but they continue to post, and so I encourage anybody who doesn't find an appointment right away to either call our get vaccinated number, or to go back in and look in areas around where you are, or talk to your pharmacy directly. Many of the pharmacies, particularly now that we've got the vast majority of the supply in, are offering walk-in appointments as well.
In general, the system has worked extremely well. Witnessed yesterday the 30,000 plus people who received vaccination appointments, in the tens of thousands who made new appointments. So the system's working well, and we make adjustments as required. So there are some communities, and right now those communities change because we've responded. Victoria had less than 10% availability for a time, and now it has more. And so there are a number of communities that have availability, but less than 10% availability of the number of appointments. Province-wide, about 50% of appointments are available. So there are hundreds of thousands of available appointments. So generally speaking, you're going to be able to find an appointment on the site. There are some communities that we're looking at, and I was talking to Rolly Russell, who's our MLA, and Oliver Soyuz and Grand Forks about availability there. And so we'll be responding to that by increasing the number of appointments in areas where there's right now less than 10% adult availability, and those include places like right now Oliver Soyuz, Peachland, and other areas like Courtenay and Lake Cowichan. So we're making those adjustments as we go along. Just to note, and that's why it's important to refresh as well. Yesterday, about 26,000 more appointments were added to the system. So we're consistently adding appointments to the system. So maybe that today there's none somewhere nearby, and you may have to go farther afield, which is not a problem in Metro Vancouver, but can be a problem elsewhere. So we're consistently adding appointments to the system. Like I say, well over 1,000 pharmacies involved, and health authority clinics as well, especially focused on children. So there's lots of availability and opportunity. And in general, people are booking in the tens of thousands every single day. So our system is working well, and I'm really proud of that system. We spent more on the system when we launched it, and we've been able to use that system as well for the booking of pharmacist appointments for minor ailments. Now it's become a great base for people that people are quite used to. But if there are issues, it's important to keep refreshing and retrying. So say you booked an appointment for, I don't know, November the 29th, but you wanted one soon. Keep checking the system, because you may be able to update that appointment and get one much sooner.
Great. Did you have a follow-up, Kate?
I do, yeah. Just has to do with demand in hospital. I know it's high right now and is probably expected to get higher as the flu season continues. We're seeing things like, for example, like a portable outside the Surrey Hospital to help with some of the demand, even just in waiting rooms and things like that. Curious if you have any update on that specific one outside of Surrey Memorial, or if we're expected to see that sort of thing at other hospitals to kind of help with the demand.
Yeah, in June, and I reported on the first 3 months in September, and I'll be reporting on the next 3 months in December. We started to take 30 measures at Surrey Memorial Hospital that were developed with the staff at Surrey Memorial Hospital. And this is one of the measures. In other words, it's preparing for respiratory illness season and trying to make it easier for people who are waiting in an emergency room. In addition, in Surrey, we're adding spaces for people who don't need to be in the hospital but have challenges moving into the community. we're looking at community spaces to support them to improve patient flow. If someone doesn't need to be in the hospital but needs some supports, we want to be able to provide them. So that's what we promised to do in Surrey, and that's what we're delivering on. I think everyone remembers this in their mind's eye. It feels like COVID-19 sometimes has lasted for a long time. I guess it has. It feels like it's lasted for longer than the actual time. But early on in the pandemic, and Dr. Henry and myself and the whole team, in this case at Vancouver Coastal Health, worked on it. There was a mobile hospital set up at the convention center about, I don't know, half a kilometer from here, from where we're standing. And we never had to use it, but we prepared for it. We didn't know what the circumstances would have been. There's great uncertainty. In this case, we have a sense of what respiratory illness season would be like. We worked with the staff at Surrey Memorial Hospital, and we're putting in place measures to prepare for the respiratory illness season and to ensure that our healthcare workers are supported, but mostly our patients are supported. And that's what's happening in Surrey.
Great. We'll go to the phone now. First question to Katie DeRosa from the Vancouver Sun. Katie, go ahead.
We can't hear you,
Katie, can't hear you. Okay, we'll go to the next question then. Marcella Bernardo, CBC.
Everybody, my first question is about something that Dr. Henry's already touched on, but hours after the BC CDC reported that COVID is waning, we learned there are outbreaks at hospitals in Saanich, Chilliwack, and Abbotsford. So could you elaborate on what concerns you have about that?
Yeah, so, the fact that it's been going up and down in terms of the community, people who are infected with COVID, gives us a sense of what's happening. It doesn't mean it's not here. And there are still people getting sick and ending up in hospital. And hospitals are settings, and long-term care homes are settings where we know that it can be transmitted quite rapidly between people. So we have specific definitions for declaring outbreaks. They are of different severity in different places. And thankfully with COVID now, because so many people are vaccinated and because our healthcare system is well protected through vaccination, we're seeing mostly mild illnesses in these outbreaks. But we have had a few, particularly influenza outbreaks, which have been more severe. And so it will depend on the situation, and the local MHOs and infection control practitioners work with the units to determine, is it an at-risk population? What are the measures that we need to put in place to try and control these outbreaks? But reporting of them is incredibly important so that people understand. It's one of the things that helps us understand the impact of these viruses in our communities.
Great. Did you have a follow-up, Marcella?
I do. It's for Minister Dix, if he could answer this. It's mainly about something that is happening here in Kamloops. Minister, I hate to ask you this during this news conference, but concerns are again being raised here about the timeline for completion of a new cancer clinic in Kamloops. Please give us an update on when that business plan for this project will be delivered, and can you confirm construction will start as promised in 2024?
We're on track, Marcella. You say concerns have been raised. I'm not sure where they're being raised from. We have a 10-year cancer plan. There are new cancer centers in BC and coming in Kamloops and Nanaimo, which are sort of being developed concurrently, and Surrey, which is starting construction now, the second Surrey Hospital, and in Burnaby. And those are, we're on track. Remember, we're going to go from 30,000 cancer diagnoses a year to 45,000 in the next 12 years, and that's a significant increase. And I've always believed that there should be a cancer center in Kamloops, and we're delivering on that. So we're on track, and look forward to going caroling with you up in Kamloops soon, Marcella.
Great. The next question on the phone is to Richard Zisman, Global News. Richard, go ahead.
Man, that caroling sounds fun. Dr. Henry, you used some broader language about when people are sick, they should stay home. In the past, it's just been that sick, stay home. Today, you made more specific reference to fever and other types of symptoms. Why the change? Are you worried that people are heeding this advice as people get back to normalcy, Christmas events, and all those sort of things?
Yeah, it's more. There's a lot of mild illness in a lot of people. We have a lot more immunity to some of the, to COVID, for example, right now. So it is the things that we know are most associated with infections that can transmit to others are fever, and that's a marker that you have something that you need to pay attention to, that you need to stay away from others. So fever and a cough is one of the hallmarks of respiratory illnesses, whether it's from influenza, from RSV, or from SARS-CoV-2. So just being a little bit more specific. If you have mild allergies, for example, you may not need to stay home. It's more giving people some specific advice on the things that are most important.
Great, Richard. Did you have a follow-up?
I can go. We know that vaccination uptake at the beginning is often higher. These are the people who really want to get vaccine, and then it starts to wane. How worried are you that we may be hitting that wane earlier, considering how huge the uptake has been early on? I know Minister Dix mentioned how many appointments were yesterday, but are we starting to get worried about the harder to get people actually going to get their vaccine, and what are we doing to change our approach in order to reach some of those people?
Yeah, that's one of the reasons we're talking to people today, to remind people. I think the fact that we have our reminder system is really important. It does make it personal, that to remind us that these are things we can do, and it's not too late. That's the other thing that sometimes people think. So we are at the peak of where we expect to see vaccinations be very high. As you say, we started off with people who are most at risk, and we know that we're getting really good uptake in that group, but there's lots of room yet. We're not seeing a slowing down yet, and we expect things to be quite brisk all through November, and that's good. This is the time to get the protection as we're starting to see the viruses get more and more active in the community. So you'll have the best protection as we go into particularly the holidays when we're getting together. So there's no slowing down that we see on the horizon. Now's the time to do it, to get the protection for yourself and for those around you.
Great. Next question goes to Claudia Van Emmerich, Global News. Claudia, go ahead.
Hi, thank you so much for taking my question. This is for Minister Dix. Can you talk to us a little bit about the situation with OBGYNs in the Interior Health region? Vernon is expecting shortages later this month. I understand Royal Inland in Kamloops will have 3 consecutive days without an OBGYN next week. How aware are you of this critical situation? What's being done about it?
Well, it's, to say the least, a huge focus of our effort, and our effort with doctors and communities. We've been meeting these challenges, but they're real in places such as Vernon. I personally was there meeting with doctors on this and other questions in the summer. And that's why we have, I think, the most exceptional health human resources plan in the country. And we've seen very dramatic increases this year across different types of care. There are different challenges, and this is one of the areas that we've really been focused on across the spectrum of care, and we're continuing to work on it. So we're very aware of it, very focused on providing supports for people. We know the concerns that the uncertainty involved can create. Over this year, for example, we've recruited internationally medical graduates, well over 500, in fact over 550 now, which we're going to set an all-time record by a mile, almost double the previous record in terms of that recruitment. And we're working in areas where the new payment model has left some gaps, and those include, for example, long-term care. And we've been working very closely with the doctors of BC on that, doctors who work and support residents in long-term care, in maternity care, which is very important. And obviously we've been doing work over the last number of months with hospitals, and we've had an interim agreement there, and we're looking for a permanent one. So you're seeing this across the spectrum of care, and we have unprecedented response by doctors to the payment model that we co-developed with the doctors of BC. But there are some areas of care where there are still gaps. And that's why we are recruiting relentlessly in trying to support communities where there are issues, whether it's in the emergency room or it's in this particular type of care. But this is obviously a significant focus of us, and we want to ensure we want to have as little uncertainty as possible for people in what is going to be a very challenging time in every hospital in BC.
Claudia, did you have a follow-up?
I do, yes. And on the same topic, I know that part of the plan, is sending women to perhaps other hospitals, sometimes an hour or more away. And of course, that has its own set of risks. So what happens if, another hospital that we're sending pregnant women to is overwhelmed and can't accept transfers? I would like to know what safety measures are being put in place right now to ensure that babies and expectant moms' lives are not put at risk.
Well, we have a comprehensive healthcare system, so preparation is made if there's an interruption of service somewhere to prepare to support that service somewhere else, and that's what you've seen at times during this period of very high demand in the healthcare system. I'll just give you an example, because I was meeting with doctors in Kelowna, in Vernon, in the Okanagan through the summer, and we have seen a very significant, in terms of babies, increase in demand. We went through 4 or 5 years leading into 2022 when there was really flat overall demand in maternity in the region, in places like Kelowna, and then we went 2 years of increase of 7% and 14%, which were unexpected. Some of that was due to new residents of those communities, but there was an increase in demand, and we're working to respond to that. So yes, every time there's a service interruption, first of all, we're doing everything we can to avoid that, and second of all, there's a plan in place to support people when they have to, if they were have to go to a neighboring hospital, say from Vernon to Kelowna, for example.
Next question goes to Graham Wood with Glacier News. Graham, go ahead.
Well, hi, this is hi, Adrian. How are you?
Oh, well, it's Bonnie back at the table, but that's okay.
Well, I was hoping to speak to Adrian.
Okay, go ahead.
Hi. Yeah, so I was speaking to a doctor, and they are expressing a bit of concern about how urban family doctor clinics are being, I guess, under a bit more pressure, even despite the payment model. So I think they've raised a few things here, like the business cost premium to urban care clinics that are privately owned. Doctors are not being paid for their panel payments or reimbursed. The current payment model does not factor in group care for patients seeing locums. And just generally the cost of living pressures on these clinics that are continuing to pile up. So, Minister Dix, what are you doing to further incentivize clinic operators, especially in urban settings?
So let's be clear. The new payment system is unbelievably popular with doctors and has been, I think, very effective in stabilizing the system and increasing the system. So more and more and more doctors are involved in primary care than even a year ago. I think the net number is between 600 and 700. I can give you the exact number, Graham, later. We can provide you the exact number. There are some challenges, I think, in primary care, particularly for some walk-in clinics. So we've taken action and made very specific offers for stabilization plans for walk-in clinics in different parts of the province. Made a series of offers. In addition, of course, we have invested in a lot of areas. I know you're often interested in Richmond, Graham. We have a primary care network there with a very large number of team-based care supports. We have an urgent primary care center there, and we have a contract with doctors that has taken us to at or near, in most categories, the top of the country in terms of support for doctors. So given that this is a remarkable and revolutionary change in the way that we address primary care, I think is going very well. And it's going very well because we're working with the doctors of BC every day on every element of this. There were some issues in response to the previous question. We talked about maternity care, we talked about care for residents in long-term care. And we're taking all of the remaining issues and working with them issue by issue with walk-in clinics as well. And we're continuing doing that work together. But I don't think you can draw any other conclusion with the increase in the numbers of doctors, the increase in the numbers of young doctors involved in family practice, the success of the model, the increase in the number of people who want to be involved in family medicine, the new attachments through our Health Match BC system is going well. There are always issues and we work our way through them, as with all major change. But this one has been going very well.
Did you have a follow-up?
Great, yes. Thank you for that. At a higher level of thought, I guess, doctors are, they're coming out of med school with $250,000 in debt, and there's a lot of pressure on them now, even in these urban clinics. And I know that there's a loan forgiveness program for if you're in an underserved community, 20% per year up to $5. Right? I guess the whole portion of the BC student loan would be forgiven. I guess the question is, have you thought about expanding that program, especially including bigger incentives for rural doctors, but also including urban people who are working in urban clinics as well?
Well, in June of 2022, we launched a new to practice doctor program, which was transformative for family practice that included things such as loan forgiveness and increase in new to practice doctors to encourage them to join and support family practice. It has been breathtaking in its success. And the issues such as loan forgiveness are part of it. So the new to practice contracts for both doctors and indeed nurse practitioners have all addressed those issues, and we see that. And if you'll recall as well, in addition, with resident doctors, the highest ratification, as you'll recall, the contract with doctors was ratified at 96%, with ambulance paramedics at 96%. But the one for resident doctors was, I think, ratified at 99%, indicating our priority on new to practice doctors. And it's those very doctors, young doctors, new doctors, who have been most supportive of the new payment model, of course, because they have a different view than has historically been the case in terms of wanting to run a business. And so these new to practice models, the new LFP model, have been focused on that area, and I'm happy to provide you details of new to practice contracts, Graham, for your story.
Great, thank you. Next question goes to Chuck Chang from the Canadian Press. Go ahead, Chuck.
Hi, thank you. Question is for Dr. Henry. First thing, just I was wondering if Dr. Henry could walk us through. You mentioned earlier that the worst of the season is maybe traditionally is coming up in a couple of weeks. Is there any possibility of providing us with some historical context of usually when the peak seasons are, and how does the current lower numbers play into that?
Sure. So if we think about prior to the pandemic, the main viruses that caused most severe illness that we were seeing during the winter season were influenza, both influenza A and B, and also RSV. So RSV has always been out there. It's certainly been more challenging in the last 2 years because we had a period of time when the COVID pandemic was at its peak where we didn't see influenza for almost 2 years, and we saw very little RSV. And that's really a reflection of how influenza in particular and how all of these viruses spread around the world. And they spread through travel and through contact with people. So during the peak of the pandemic globally, when people weren't traveling around the world, we saw a dramatic decrease. So normally the seasons that we would see prior to the pandemic, we would start to see influenza in October, November, and usually our peak was sometime after the holiday season when people were traveling a lot more and coming together, so in mid to late January, sometimes as late as February. And we often would see a second peak of influenza B later in the season, so into February, March, and sometimes even as late as April. So those are historic trends that we see. Those have been disrupted in the last last few years, mostly because of the lack of travel. And what we saw last year was quite different, where influenza came back. And it came early. And we saw that in the southern hemisphere as well, where we had an early peak. It was up dramatically in October, November, and the peak was in November, and then it went down, and we had very little influenza for the rest of the season. So that's something that we were watching. We're not seeing that pattern this year, thankfully. We're seeing something that's more going back to the usual patterns for influenza. We have started to see outbreaks, as we mentioned, in long-term care, and we're starting to see increases in detections in our wastewater surveillance. So that tells us that influenza is circulating and that we're likely to see more of it. If we go back to the previous pre-pandemic patterns, we're likely to see a peak in January, and we may see some influenza B later in the season. Last year as well, we saw an early peak at the same time as we were seeing this influenza peak of RSV, particularly in young people. And we're starting to see that increase in younger people and children, especially young children. So that's something we need to be prepared for, and that's some of the measures that we saw being taken at Children's Hospital, at Surrey Memorial, places where have pediatric care. So we're starting to see that increase a little bit as well. We know that immunization makes a big difference in helping to settle those things down. And what we are seeing now is that we have a new virus in the mix, and that's the SARS-CoV-2 virus. And whether it's going to follow patterns that have this earlier peak and maybe a later peak in the spring, we don't know that yet. So the monitoring is still telling us, that reminds us that there is still a lot to learn, although for the most part, what we're seeing is smaller and smaller oscillations of the SARS-CoV-2 and not as dramatically different changes in the virus as we were seeing in the first few years. And partly that's because of the level of immunity we have across the board, as I mentioned, from combinations of vaccination and infections that make it less easy for the virus to gain a hold and to take off, even if it has a slight advantage in terms of infectivity. So those are all neat stuff that we're following in the science of this virus and the evolution of the viruses over time. And that's why it's so important that we keep track of these things and we post that information. And there's no one single thing that tells us what's happening. It's a matter of looking at different whether it's hospitalizations, visits to primary care, the wastewater surveillance, all of things together give us a sense of what's happening. And so I believe we are going to see more influenza in the next few weeks. We're likely to see a peak in December, January, very similar to what we saw prior to the pandemic. And still unknown what we're going to see with SARS-CoV-2 over the next few months.
Chuck, did you have a follow-up?
Yes, thank you. Dr. Henry, with the recent lower COVID-19 activity as the CDC numbers that came out yesterday indicate, do you have any concern that people might believe that the current wave, the spike that we saw in the late summer, early fall of COVID is over? Are there any concerns regarding how to make sure people's guards are up despite the fact that the activity numbers are lower? And is it correct for people to assume that this latest spike is over? Thank you.
Yeah. Well, I think the key word you said there is lower. So yes, we saw a peak a couple of weeks ago, and things seem to be settling down. But that also corresponds with immunization, particularly of people who are most at risk. So we started with older people, people who had immune system dysfunction, for example, or immune systems weren't as strong. So it does tell us again how important vaccination is at trying to stop the spread of this virus. And it protects us as an individual, but it also means that there's less of it around to spread to others. So I think that's part of what we're seeing right now, and we're just going to need to watch. And that's why we're saying today how important it is. It's not too late. This is not over. It's not behind us. And it has still come back and surprised us in the past. there are many things, and I think it's sort of humility in the face of this changing virus. We still don't know everything about it yet. We know a lot more about influenza than we do about SARS-CoV-2, but we're learning. And this will be another season that will help us understand for next year what we might expect. But right now, it's important that we do take that measure of protecting ourselves and those around us, and getting vaccinated is the way to do that.
Great. The next question goes to Lauren Collins with Black Press. Lauren, go ahead.
Hi, my question is for Dr. Henry. It's around the avian influenza. So are these outbreaks, the 16 that have been reported, worse than in previous seasons?
Yeah, so we don't have, previous seasons is a bit of an anomaly. Generally with avian influenza, what we've seen is outbreaks that we have been able to contain and get rid of. And you may remember in 2004 there was a big one that, and when we talk about high pathogenic avian influenza, what we're talking about is the impact of the virus on poultry. So chickens, turkeys in particular, and ducks. So these have been devastating to the farms that are affected, and the response to them, so that it doesn't spread more, is unfortunately having to cull the birds. And so we did see last year that this H5N1 that has been spreading globally, as I mentioned, across the US and Canada, caused devastation for a large number of farms. The last outbreak that we had was on April 29th of this year. And so we were all holding our breath and waiting to see what was going to happen in this migratory season in the fall. So globally, wildfowl migrate at 2 different times of the year, and that's when they can bring the viruses with them and shed them into new areas. So I know the poultry industry has been working very hard on what we call biosecurity, making sure that the birds that they grow are protected from exposure to wild birds, whether it's through feed, through water, through people coming in and out of farms. But this year we're also seeing again that farms can be easily affected. Some of them are large commercial farms, some of them are smaller backyard flocks. So in terms of severity of the illness for the birds, it's been devastating, and those farms and farm families who have been affected, it's been very, very challenging for them. And thankfully, this is not a virus that spreads very easily from birds to humans, but we still need to be very careful about that. And what I was talking about is this time of year when we have human influenza viruses spreading between people, and if we have somebody who gets infected with both a human and a bird virus, that virus can reassort, we call it, and create a new influenza virus that could be more infectious to humans. And so that's a risk that's in the back of our mind all the time with these, but working very carefully with CFIA to try and stop these the viruses from spreading between poultry farms, and that's the big focus right now. It is becoming clear that this H5N1 that is spreading in wild waterfowl is likely to become endemic in those populations, so in wild birds, and that's going to mean it's a risk for the future as well. We still don't know all the details about that, but the fact that it's come back again with this migratory season is very worrisome.
Lauren, did you have a follow-up?
No, that is it for me. Thank you.
Thank you.
Great, thank you. The next question goes to Cindy Harnett with the Times Colonist. Cindy, go ahead.
Oh, thanks so much. Dr. Henry, I hope you'll forgive me for going off topic and way back in time, but can you tell me where you are with your report on the recommendation to improve safe supply and in your response to the province's rejection of recommendation of providing non-prescription safer supply, and what, if any, influence did that rejection have on the finalization of your report?
Yeah, so as I've been quite open about, I was asked to have a look at the limited prescribed model that we have for alternatives to the toxic drug supply, mostly because of concerns being expressed about how it was working, concerns that providers have about whether the medications that were available were the right ones. And so I spent quite a lot of time over the last few months listening to a lot of groups of people. One of the things that I know has been out, at least talked about publicly, was part of that, which is a What We Heard report, which is again a draft right now. And I am working on a broader report with some recommendations to government about what I've heard. We're in the final phases of that, and I expect to have it to government within the next few weeks. And our expectation is that we will make all of this public when they're in the finalized form later this year. So to be clear, there is this What We Heard report. There's a report with my recommendations to government coming out of the consultations we've done. There's also a literature review that has been done by the BC Centre on Substance Use that they've provided to me to help guide some of the work I'm doing. And we also have an ethical review from a population health perspective that our provincial ethics team led by Dr. Alice Varani has been working on as well. So those are 4 important pieces that we're in the final stages and will be coming out and will be shared publicly later this year.
Cindy, did you have a follow-up?
Yes, good. Thank you so much for that, Dr. Henry. Minister Dix, 3 clinics have been told by the Medical Services Commission to shut down their private pay MRI operations. Can you comment on the size of this problem in BC and how stopping them impacts, positively or negatively wait times for diagnostic tests?
Well, as you know, Cindy, we've set and then shattered every record for diagnostic testing in BC, both for MRIs and CT scans in the last number of years, which is an extraordinary success given the pandemic. There is significant demand as well. With respect to these cases, we make in British Columbia, we set the we write the law and we make the law and the regulations, and the Medical Services Commission enforces the law. And in this case, the Medical Services Commission is doing exactly what it should do, which is enforce the law. And you've seen this in other cases recently. And what it shows is our robust determination not only to deliver diagnostic care in unprecedented numbers and to break every record we have so that more people can get care, keeping our public MRIs open, as you know, 24 hours a day. People often tell me about their appointments at 3 in the morning. And also working to ensure everyone's acting within the law. And that's our expectation. That's what we're going to continue to do. And the people who do that, who enforce the law, and ensure that happens to the Medical Services Commission, of course they have my support, but they're also independent of me, and they're doing exactly what they should be doing, which is ensuring that the law is enforced so that patients are given protection and support.
We have time for one last question, and it goes to Yann Lacoste en français for CBC Radio-Canada. Yann, go ahead.
Perfect, thank you very much. Yes, question pour le ministre Dix. Voilà, c'est possible, Monsieur Dix, d'avoir un résumé en français de cette annonce aujourd'hui de l'importance de se vacciner pour la partie vertige.
Oui, je pense que, so I'll just say in English that, we talk about peaks and valleys of COVID-19. We know what's going to peak in the next few weeks, and that's coming together in our communities. And so this is the time to get protected. It means, of course, in healthcare, it means wearing masks in hospitals. It means wearing masks in care homes. And but it mostly means that this is the ideal time today to book your vaccination. Je dirais en français que la campagne de vaccination contre les maladies respiratoires de cette année a été lancée le 10 octobre 2023. à la fin de la journée du 9 novembre, la population de la Colombie-Britannique avait été vaccinée contre les maladies respiratoires et administré 1 072 505 doses de vaccins contre la grippe et 847 458 vaccins contre le COVID-19, ce qui mène le pays, bien entendu. Cela indique la force de notre et la capacité de notre système et surtout nos pharmaciennes dans la province et notre système en général qui a engagé le public d'une manière exceptionnelle. Bien entendu, il y a beaucoup d'opportunités disponibles actuellement, aujourd'hui, dans des centaines de milliers pour des gens d'être vaccinés. J'encourage tout le monde de prendre action aujourd'hui. Nous sommes quelques semaines du système de la saison de Noël et des soirées dans nos lieux de travail, mais aussi dans nos écoles et un peu partout dans la province. C'est un moment de rassemblement pour tout le monde. Et donc, c'est le moment important, capital, d'être vacciné maintenant et de prendre des autres mesures et d'adopter des habitudes qu'on comprend bien depuis quelques années de COVID-19 pour éviter le COVID-19 et la grippe. Donc, c'est le moment. Être vacciné est important et j'encourage tout le monde de le faire. Et c'est facile dans la province de la Colombie-Britannique.
Merci beaucoup. Thank you very much. And that concludes today's event.